if you're starting early with this quite destructive treatment in order to get that cosmetic look, you might be then losing teeth. Having gum disease while you're pregnant can affect gestational diabetes. It can affect preterm birth, so lead to preterm births. It can lead to low birth weight and even preeclampsia are associations. I can't say one absolutely causes the other, but I can say, do you know there's a really strong link here between oral health and pregnancy? If you are 19 and you are going to have 20 crowns put on your teeth, those crowns will need replacing again. So crowns, some people might call them caps, it's easier to understand, but they will need replacing before you're 40.
Electric toothbrush or manual toothbrush, the gap is really narrowed in terms of people's expectation of teeth, the way they look, especially with like people going to Turkey to get teeth done. They would maybe go there before even ever going to a dentist. Because skin isn't just skin, it's your story, and I'm here for it. I'm Kelly Saynor. Are you ready for some Barefaced Chat? Welcome to my podcast. Everybody, welcome Jan to my podcast. Welcome to Barefaced Chat. It's an honour to have you on as a friend and an advocate and a fellow woman. And I want to get into a few different topics with you, babe, because I think we could really, you're so articulate and so passionate, and it's the passion that comes out, and I think you've said the same about me. You can see it, and I think that we draw to each other with that as well. But I could talk to you forever. In fact, I think maybe what we could do is like bring you back and talk about other things. Things like halitosis and things that worry loads of people if they're going on dates. If they're, do I floss? I've got receding gums. For God's sake, like, what does that mean? I'm old. Oh my God, what does that mean? Like, nobody really deep dives that. With you, they'll just go, they're receding a bit, which means that we need to be careful when you're brushing. Is that it? It's there's so much we could talk about. Anyway, let's start off with confidence, because the first thing that people see about you, about anybody, is you smile. Yeah, you do. That is an expression that you have got, and it's an expression that is innate. We can't take it away. And the way you smile will tell you will know this story about people. So what do you think the biggest thing that people don't realize about teeth that can affect their confidence?
Oh my gosh. I mean, that's
or self-worth.
That is it's a huge question. But what I would start off by saying is that our teeth and our smile carry a third of the weight of the attractiveness of our face. So a third of our attractiveness is made up of what you see when somebody smiles and what your teeth look like. That's huge. Attractiveness is huge for women. Absolutely. It's so sort of integral to our identity. It's what we read and hear about in the media, and our teeth are a massive part of that. And I think what we've seen is, say the last 20 years maybe, there's been a real ramping up in what normal is, what normal looks like now. And I think maybe 20 years ago we would have accepted, teeth that have a little bit of stain, maybe they weren't in perfect alignment, but normal's been changing, even to the extent that people are now having like gingival lightening to remove racial pigmentation, for example. So that is a thing. So what is normal? And are we talking about, that smile that looks straight and it looks white and it looks perfect? And I think because that's what we're seeing that on shows, maybe we're seeing that on Love Island, maybe that's what celebrities look like. We're starting to see more and more people around us who might be going abroad for dentistry and they've got that straight white smile. It starts to make us reflect on ourselves.
And is it because it's attainable now? I think years ago it was never really, it was only for the rich and famous. Yes. All of a sudden now everybody's doing Invisalign, everybody's doing whitening. Do you think it's because it's more attainable?
Yeah, and I think it becomes, then it feels like almost a moral failing if you haven't maybe kept your teeth in a certain way, in the same way that perhaps women feel pressure, and you might have experienced this yourself in your career around Botox, around fillers. Almost now, most of the women I interact with regularly have Botox, have fillers, and that's fine. But that then becomes, I'm not normal because I haven't gone down that route yet, but I may well in the future. But it starts to make you think, oh, am I different from the people around me? Yeah. How am I different and why? Yeah. And why am I not doing what other people are doing? Why do I not look like that? So I think people then become more self-conscious about smaller things. Yeah. So in some of my recent studies where I've looked at people feeling self-conscious, and my studies of, I'm what's called a mixed methods researcher. I look at numbers, but I never look at numbers without words and people. Okay. I'd never look at the one in isolation of the other. Wow. I put them both together because they both make a picture and they tell me a story. And so when I've been looking at some experiences of people with stigma, and I've been looking globally, people that feel stigma, they feel a self-consciousness issue around their oral health. When we're looking at countries like maybe in Africa, maybe we're looking in Southeast Asia, and we see the research that's coming out of there, the issues that people are concerned about are big ones. I mean, like cleft lip and palate.
Yeah.
I mean, like something called noma, which is where you get sort of a large facial defect. They're really worried about those things that are big and they're visible. But then you turn to the global West and you start to look at what the research is saying there, and people are not smiling or hiding themselves away, not socializing because of very small sort of crookedness in their teeth or because of, some mild staining. So there's this maybe a global West preoccupation because, as you say, it's become a much more commercial industry in dentistry. It's now commercialized and commoditized, abstract from health. There's this aesthetic side to it. And then people feel that expectation, I've got to move forward here. But it takes its toll. I mean, I've spoken to people who have said that they haven't ever taken a photo of them smiling with their child until they had Invisalign and they had their teeth straightened.
Wow.
So every photo, there was people use many different tactics, scarf over the mouth, hair over the mouth, hands over the mouth, putting your lips over your teeth so that you can't see them. So there was no picture of her with her child since they were born until the age of, I think it was about almost 7. And I thought, well, what an impact is that?
Wow.
So it's nuance. It's about social norms. It's about how we internalize them and then make sense of ourselves in relation to them. And we diminish ourselves. And there's something here about stereotypes.
Yes.
Okay, because there are so many stereotypes about what normal hygiene is.
Yeah.
In, let's say, in the UK, for example, okay, and that's brushing twice a day. That's
everybody
doing that.
Should everybody be able to brush their teeth? Is there any excuse for not looking after your teeth, irrespective of your socioeconomic status?
Do you mean in terms of brushing day to day?
In terms of looking after, brushing day to day.
I would say there's no real good reason that I can think of why you shouldn't brush day to day. There might be times where, for example, if you've had like a new heart valve, you may not want to go to the hygienist and have something that is that little bit more invasive than home brushing.
Got you.
But home brushing is absolutely fine. Yeah, so I would advocate for that. But there might be times where people simply cannot brush.
Okay.
Like, your mental health has taken a slide, you're experiencing depression, you can't get out of bed. Like there may be behavioral reasons why you can't brush. Women, now we're seeing a lot more women diagnosed with ADHD much later on. And this really has, WI have done a bit of work with their members around this. ADHD has a massive impact then for oral health. So there might be times where, because you sort of feel more chaotic or life is more chaotic, brushing falls by the wayside.
Wow.
So there's no reason why people shouldn't brush, but there might be times when people just simply feel like they can't.
Yeah.
And I get that.
Fine.
Yeah.
And that makes so much sense with what you've just said. And if we can just maybe pivot a bit on that point and really draw back out that sort of self-confidence perspective. And when you were talking through the reason why, I just wanted to drill down on, we've all got the same opportunity. Even if you're on the street, you can still brush your teeth, right?
Yes. Yeah. And we see that. So just recently I've been doing, as you know, a lot of outreach work with sex workers in Liverpool. And we've been talking to, I think we've talked to about 22 sex workers now about their oral health. And no one speaks to this group of women. No one's talked to them about their oral health. And I was seeing a real stark difference because there are some women who are sex workers, they are using heroin, they're using crack, and they have, maybe not a single tooth left. Potentially quite a few of them had very poor teeth,
horrendous,
broken and crumbled. But then there were others who were also living in the same environment. They were also sex working. They were also using multiple drugs, and yet they had very little damage to their teeth. They had suffered very little pain, and their teeth were looked at, and they had kept up a relationship with a dentist, and they were brushing their teeth, and that it was a priority for them. And some of them were saying, when I was a kid, it was my parents, it was just drilled into me. It was such an ingrained habit. And this is perhaps what it is, that sometimes habits can overcome changes in life, like with skincare.
Yeah, of course. Yeah.
Like with oral health.
Is
it's
it
routine.
genetically linked though? Like, are there things that you just cannot, are there some things that, no matter what, whether you brush daily, whether you go to your dentist, are there some things that just we can't overcome?
Yeah, do you know what? Yeah, let's talk about that, because I think that's an important question. So there are a proportion of people who have gum disease. And this is severe gum disease, so it makes up quite a small proportion, who have An issue with their immune system. Okay.
Yeah.
So it's about sort of 10%-ish people that would have a genetic link around about that. And it means that when you have some bacteria in your gums, instead of responding in a very normal kind of controlled way, your own immune system just overreacts. And it's actually that overreaction of your immune system that damages your gums and creates like a severe gum disease.
Wow.
So there is that genetic component. However, that interaction, like the idea of epigenetics, it means that the oral hygiene just has to be that much better.
Okay.
There has to be more frequent hygiene visits, those sorts of things. So even though we can't ever get rid of that genetic component for that small proportion of people, we can kind of mitigate for that to an extent. They will always have more than the average person, but it's about finding ways to kind of manage that for them. In terms of dental decay, there's not a huge genetic component there, but there are certain like bacterial profiles that mean that certain bacteria are more likely to give you dental decay.
Yeah.
And if you're a baby, for example, you're eating off the same spoon as your mum and dad, right? If your mum's had lots of fillings in her life, maybe your dad's had no fillings in his life, it would be sensible that if the dad is feeding the baby off the spoon, it's going to be providing some sort of a protective bacteria as soon as that, at the start of that life, rather than maybe mum, if mum's had lots and lots of dental decay. Yeah. So it's just like those first bacteria to colonize in your mouth. It's giving you something to think about. Yeah. So it's just something to bear in mind. That's not going to be the dictating factor throughout life, but it's there to consider. But a really good question, because I think so many people come in, they go, well, it's just my genetics. And actually we have so much control over our oral health, what we can do at home. And when people talk about going to the hygienist, maybe say the issue is that I haven't been to the hygienist enough. For most of it, the issue is what's happening at home twice a day, every day, and 2 minutes is your minimum.
Yeah.
Okay, so maybe, you and I, we could get away with 2 minutes and a bit of a floss, but if someone comes to me and they've got periodontal disease, I'm going to say 2 minutes is not going to cut it for you.
Yeah.
We're looking towards 8 minutes. We're looking towards 10. I need, every single space in between your teeth really clean, because that's what you need.
Do you know what?
And it's tailored.
I must say, I don't know about everybody else, but I am guilty of, if something's got to go, I'll do my teeth later.
Yeah.
Why do we feel like that? I'm doing my face, but if something's got to go, I just give it, I do it when I get back.
Yes.
I will not prioritise my teeth. I mean, generally I prioritise my teeth. It's important. I do the same with my kids.
Yeah.
I drill it into them. That's what they do. However, as I've got older, it's one of the ones that maybe will just lax a bit if I feel I'm running out of time. Yeah. But that really, really, it gets to me, because obviously I can't do it when I'm in clinic, but in the morning, if I wake up late, whatever, very rarely happens. But I will not give it the full 2 minutes, or I'll just say I won't floss today. But I don't know why I feel like that.
Yeah, I think that is normal. And I'm often talking to parents when I see children, and they're talking about how difficult it is to get the kids to brush and to find the time, and you're doing the school routine, and to find our own time for that. So let's be honest, standing in the bathroom for 2 minutes, looking in the mirror, it's boring.
It feels like forever.
Okay? I can't make that any interesting. So, and I'm a wanderer. Like, personally, I'm a wanderer. I'll be brushing, I'll wander into the bedroom, I'll maybe get under the duvet for a little bit, and I brush my teeth.
I do. Really, 2 minutes.
Yeah, and I wander back. Because women like you and I can make a lot out of 2 minutes, right?
Absolutely.
2 minutes, we could have sent an email in that time.
For sure.
More than one.
So true. So true.
So I like to, when I'm thinking about people's oral health, I don't give generic advice. I'm like, what works for you?
Yeah.
So I'm like, do you put the kids in the car on the way to school? Okay. Yes, they're strapped in. They're not running away from you. I'm like, if this works for you and your family, may or may not, have your toothpaste and your toothbrush there. You use a tiny rice grain sized amount of toothpaste, and the kids, especially with younger children, they're too young to be able to know how to spit out anyway. So they tend to swallow most of that. But that gives you an opportunity where they're sat there. It's part of your routine. We get in the car, we strap you in, we do a quick brush.
Oh,
and so you've got to just think what works for you. And if what works for you and I is, I'm going to move to a space where I sit in the bed, and perhaps actually while I'm sitting in bed brushing my teeth, I'm doing 3-4 minutes and not even paying attention, because I'm sat down, I'm sort of sat down, I'm cozy, I'm not thinking I want to get out of here. We might actually do a bit of a better brush. So, for me, this old idea of standing in front of the mirror for 2 minutes, I think that doesn't fit for everyone, and it puts people off. Do you need to brush in the shower? Is that going to work for you? Some people find that it's revelatory taking a toothbrush into the shower, and that's where they brush their teeth, because maybe some people prioritize showering. Showering always has to happen. Lovely. Keep your toothbrush in your shower space.
Look, I think we need to just like Hail Mary this moment, because I think you've given people permission that absolutely, you know, kill themselves for not doing it. They get, oh my God, I can't do it. It takes me forever. And then get really upset about it, really want to do it. I think you've just given people permission to just say it's okay.
Yeah. Do it your way.
Do it your
because
way.
if sitting in front of the TV and brushing your teeth while you let yourself watch a little bit of your show in the evening is going to mean you brush instead of not brush,
do it.
do it. Yeah.
Thank you.
Give yourself back that permission.
That's unreal. Gosh, that's incredible. Okay, so quite nicely then, that really moves into everybody answers the questions before I've even done it. So like we've already got there.
Yeah.
And it's about mindset shift. And we've already talked about it. And if you can give yourself that minute, I think that is just, people aren't saying this. Yeah. You feel guilty. You feel guilty. I feel guilty. And especially with Cole, you know, I feel so guilty for potentially not, you know, in the morning, I will labour myself. I will walk over hot coals if I'm like, oh my God, I forgot to do his teeth. I really will.
Yeah.
And then I think that because he's had to have a tooth out. And I've always said it's because I've got quite weak teeth. And I remember the dentist saying to me, they're white, but white teeth are generally weaker. Is that true?
So I don't know about that. So that's not something I've come across before in terms of white teeth being weaker. What I do know is that I do know that there are certain teeth in our mouth. So our number 6 tooth, it is the 6th tooth back. It is the first molar that emerges into our mouth at age 6. It is the very first one that comes out when we're still very young. And our front teeth, they can suffer from something called molar incisal hypomineralization. Big words. But we'll call it MIH for short. And what that means is that at that time when those teeth were forming, which is usually really sort of early in life, maybe shortly after birth, during birth, anything can impact on the integrity of the enamel. So it could be, and by anything, I mean things like a difficult birth, a C-section, having a viral infection, mum having a viral infection during pregnancy, antibiotic use at that time. So when those teeth come out into the mouth, you can see they look different.
Okay.
So they might have some white spots on them. They might have some sort of yellowy spots on them, and they're much more prone to dental decay in those number 6 teeth back.
Yeah.
And also they're coming out at such an early time. One of the things that, and so commonly parents don't appreciate this, is that because we can see at the front, a tooth falls out and a big tooth replaces it. And you can see that that's happened. These sneaky little number 6 teeth, they just pop out of the gum. You know, there's nothing that has to fall out for them to erupt. So they just turn up in your mouth around about age 6, and parents don't even realize that an adult tooth has come out.
Wow.
So then we're not prioritizing the brushing of those teeth because perhaps parents don't know that that's even an adult tooth to start with.
Got you.
And then if it's got issues with integrity in terms of its enamel structure, it's much more prone to decay. It's going to be affected quite quickly. And that does happen. And we see that the incidence of that, so how often that's occurring, is increasing. It's increased a lot. We see it a lot more now, for many different reasons potentially, but it is something that means that those teeth are weaker.
Wow.
So there is some truth to that idea that some teeth can be weaker, and it tends to be those ones that we
more
see.
enamelled teeth, you know when you see people with deposits on their teeth, my sister's teeth are so strong and my teeth are really, really weak. I mean, we're not genetically linked, but why would some people have more enamel than others?
Yeah, so people tend to have the same amount of enamel. Well, similar proportion around the outside of the tooth. What you can see are differences in other things like fluoride exposure while the teeth are developing. So sometimes you might see people have slightly white spots on their teeth at the front. So that can sometimes be associated with fluorosis. So if we have a little bit excess fluoride, that's not to say it's a bad thing, but there might be some in the water, like for example in the West Midlands, we might see more sort of fluoride spots. And those teeth can be stronger because they've got more fluoride that's been taken up into the tooth structure as it's developed. So that could be one reason why. Other things can be lifestyle. So there's lots of things that can lead to us having less enamel, so that it wearing away. And that can be things like exposure to acids. So orange juice, having tea with lemon in it, having low pH drinks, stomach acid, so repeated vomiting during pregnancy. All of these things can lead to enamel loss over time. And hard brushing. If you do brush really hard, especially if you've had something that's either sugary or acidic and you brush your teeth within a half an hour, you can kind of brush away that enamel more.
Okay. We've been brought up exactly the same though, and had the same exposure to food. But I've had a gazillion fillings. She's had barely any.
Yeah.
Like,
interesting,
just
isn't
is what
it?
it
Maybe
is.
different bacteria in your mouth.
Yeah.
I mean, there are some rarer genetic conditions, like it's something called amelogenesis imperfecta and dentinogenesis imperfecta, which I think is worth mentioning, but they are rarer and they're like a genetic inherited condition. You'd see it on all of your teeth. They have a characteristic appearance. The teeth maybe look mottled, they look browny, and the enamel comes away or the dentine causes problems. Very, very sensitive. But we don't see that as commonly. That is a rarer condition than things that
so interesting.
happen often.
You've worked with people across a massive sort of gamut and all walks of life. And I think maybe it's an industry where you are exposed to every type of person and every age. Yeah. So you have to be really adept at being able to, and quite agile in your approach, I suppose.
Yeah.
And, you know, I suppose coming from sort of a more medical background, especially working with peds, you're exposed to a real multidisciplinary like team in terms of the people you work with, as well as the families that we work with. You know, you're working with mums, dad, aunties, uncles, granddads, kids, siblings, your colleagues, and then all of the people that you're dealing with as well. I feel like with dentistry, it's so unique because you're working with, it's one of the only, you know, I guess, industries where you do see everybody.
Yeah.
So you said you've got like a special interest in things. And I think that people that come in and out of your practice, and you might have seen people for years and maybe seen them from young and moving into older. It's an area of health, I think, where you can feel quite judged for not looking after your teeth. Yeah. And people, like you mentioned before, like anxious kids, what's going on, but you've already highlighted that. I think that's a really interesting point. Is it something that we can bring up to our dentist? Can we say to you, I'm not feeling great.
Yeah.
I'm what can I do?
Yeah.
Like, can we bring this up? Because if people are feeling judged or embarrassed or whatever, and not wanting to go, how do we approach you guys when we've got minutes and it's not really an arena that we feel we can? I might say that's my GP, but I certainly wouldn't say it's my dentist. But you've just allowed us to be able to say it.
That's an interesting point, isn't it? Because I feel like in certain areas that's welcome. So if I was coming to you to talk about skin, I'd be very much coming in, okay, I'm feeling self-conscious about my wrinkles. I'm feeling self-conscious about this aspect of my face. Let's talk about it. Let's explore it. The conversation is really open.
Yes.
And you know, there are lots of issues, whether that's self-consciousness, because there really is something there that looks different or feels different, or even it's just self-consciousness because you're aware of it, you know, something like body dysmorphia, for example. Mm-hmm. I think that every dentist, like every individual patient that comes in, is a different person with a different character. And if you are, you know, comfortable with your dentist, if you feel safe with your dentist, they will gladly have that time to speak with you. It may be that they can book you in for a review when it's not a quick checkup appointment. You know, can I come in? Can we talk about some options? Can we actually talk about what goes on at the dentist? Because you might come in and you might think, you might have one thing in mind. Oh, I'd like some whitening, or, you know, and perhaps I could achieve that with a full mouth of veneers.
Yes.
And actually you can have a conversation with your dentist. You know, what options are there?
Yeah.
Because I'll go in, I might be thinking about, well, what could I have done for my skin? But I don't really know what's out there.
Yes.
I need someone to kind of guide me and have those conversations.
Yeah.
I would say for the most part, you know, many of my friends, even my family are dentists, all very understanding, really compassionate individuals. And I think now, as we're seeing a next generation, a much more trauma aware, much more shame aware generation of dentists coming through. We are learning more how to have compassionate conversations to validate and legitimize people's concerns, and then to move forward in a minimally invasive way, usually where that's possible. So I'd say, like, in the UK, we tend to favor doing things that are not going to permanently damage your teeth. Yeah. So I think a lot of why people come in, aesthetic concerns is number one, but people do worry about things we've mentioned, like, does my breath smell?
Yes.
You know, I'm concerned about the way that I look. These are the big things, or things, even if they are not visible things to others. People worry about them.
Yeah.
I spit in the sink and red was there.
Yes.
What does that mean? Or I can feel a hole at the back of my mouth with my tongue, like, what's going on? And that they've been holding that inside because we know what it says about us. It says, maybe I've not been brushing my teeth. Maybe I've not been looking after myself. Maybe I've not been eating the healthiest diet. And we're sort of maybe worried about the dentist being telling us off. Kind of thing. So there's loads going on, isn't there? Because there's that anticipatory anxiety that's going on. I'm worried about what's going to happen when they look in there and when I tell them the things and then they ask me the questions, how that's going to make me feel about myself. And I would say most dentists would be compassionate, they'd be kind. If you find that you're with a dentist you don't feel comfortable with, you're not getting that time, you can look for another dentist. It doesn't risk your registration where you are. It's important, as I would look for somebody I feel comfortable with and trust. I'd also want patients, if they're not feeling that connection, then you may need to just go and speak to somebody else and explore someone around, recommendations from friends, things like that as well. Because, we're not perfect. There might be some people who come in to see me, they go, oh, wow, really love Jan, I've had a great time. But there might be others who walk out and go, oh, she's too much for me. Kind of thing. And they might prefer a different approach. Yeah. And I think that's so there's a couple of different things there.
What's the number one reason people are scared of the dentist? Because this is huge for me, and I think it starts from really young. But is it pain? Is that the number one reason?
What scares you about the dentist?
I get very inner child about the dentist.
Okay,
so I'm
Tell
like,
us more about that.
The dentist means to me either tooth out, filling, being told off. It's not. It doesn't initially invoke you with a nice experience.
Yeah.
You don't go to the dentist to get a positive experience. You normally go because something's happened.
Yeah.
And that stigma needs to disappear.
Yeah, it does. It does. Because it's a part of self-care. And there are things that we might do as part of our self-care, like, maybe microneedling or something, which is minimally invasive, but it's uncomfortable. You need local anesthetic on your face, etc. But we perceive that as self-care, and yet we're doing a kind of similar thing in the mouth, and we're like, oh, this is really scary. And I think that there are some different reasons for that. There's like this power dynamic between the dentist and the patient sometimes, I think.
It's a vulnerable position.
We lay people back in the chair. Yeah. We're asking to look in a very private space. Yes. Our mouth, no one gets to see in there. That is a really private space. And you're back in the chair. Maybe you have a towel on you. Maybe there's a suction thing in your mouth. And you're wondering, all sorts of things might be going through your mind. It smells different at a dentist. I'm hearing sounds I'm not used to hearing. It's noisy. I don't know what to expect. So there are lots of things that can lead people to then having either memories or feeling anxious about the dentist. And I'll just share for your listeners, I went into dentistry because I was an extremely nervous patient.
Wow.
Extremely nervous patient, and have spent most of my career there, my clinical career, working with people who are nervous, people who have challenges coming to the dentist, doing sedation, working with people with additional needs, and people with phobias, because I understand. I understand where people are coming from. So I think that it is, I wouldn't say it's universal. Some people do love coming to the dentist and they fall asleep in the chair and we've got a TV on the ceiling and they're watching the TV and they're watching Friends or whatever their choice of preference is, and they fall asleep, and that's great. But for other people, including myself even now as a dentist, it is an awful experience. I like to be in control. Yeah. And my husband does my dentistry, full disclosure, and I'm a terrible patient. And I'll be watching him with a hand mirror going, oh, I might do something differently, but I want to feel in control of that. Yeah. But there's loads of ways. So just some actionable points here in terms of when you go to the dentist. We are very familiar with this, okay? So many people feel phobic. They tell us, they let us know, and do let us know, because then there are things that we can do to help you to empower yourself. If you don't want to lie all the way back, maybe we can accommodate that and we can find a little halfway that's more comfortable for you. Get a hand signal going, okay? So when you raise your hand, okay, on the side of the nurse ideally, so that if the dentist got the drill, it doesn't cause any damage. But, raise your hand, immediately we will stop. Sometimes I enjoy counting. So I'll say to somebody, do you know what? Let's start off at 5 seconds. I'm going to 1, 2, 3, 4, 5 and check in with you. Yeah. I explain to all my patients, I don't like surprises. I don't do surprises for other people. Okay. I'm going to explain to you what's going on unless you ask me to do otherwise, and I'm not going to surprise you with it. If something's going to feel different, or it's going to feel uncomfortable, I'll let you know in advance.
Yeah.
And so in that way, I'm building trust then with people. They know, okay, this person's not going to surprise me. Nothing's going to come out of the blue here. We can stop at any time. I can raise my hand. And then there are sensory things. So for some people, the sound, the sensation.
Yeah.
Okay, maybe there's a TV on the ceiling. Maybe bring in your sound excluding headphones.
Yeah.
Let's accommodate that. You have your favorite thing on. I used to listen to like a hypnobirthing tape, but that for me really calmed me down so that I could then have some treatment done. So there are lots of ways you can empower yourself at the dentist, and you can think creatively about it.
Yeah.
And for some, for example, children with autism, it might be easier if they have like a red and a green, like, so they can not just let you know when to stop, but also when they feel safe to go.
Oh, that's great.
So, all sorts of things that we can work with and be adaptive.
Oh, I absolutely love that. Gosh, that's so interesting. we're like, literally just get a duvet on and listen to Janine Yazdi-Doughty about dentistry. It's so interesting. And you're so articulate the way you explain it. It just, you've got such a calming energy, and I need you to be my dentist. So we talked a little bit about how trauma kind of maybe shows up in somebody's mouth. Now, going off topic a little bit, and I'll bring it back, but if somebody's been through a traumatic experience, or like, let's say there's a few things in our lives. So we know that hormones can affect teeth. Yeah. We know pregnancy can affect teeth. We know going through certain illnesses can affect teeth and we get told that, you get told during those big life events. Yeah. If you've had, if you've had your teeth knocked out, these normal everyday occurrences that are huge when it happens, and you you hope to God that you're not the one that suffers. How do you think it's managed well by the NHS? How do you suggest people approach the dentist? Is it very expensive to fix these things because it's through no fault of their own? Yeah. I just kind of want to understand a bit more about these sorts traumatic events.
Yeah. So you mean really trauma, like physical trauma?
Physical trauma, or potential life traumas, like normal stuff, like we go through, like when we're pregnant, we get told to look after our teeth. Our teeth can fall out. Yeah. You can go, there's so much, because it's such a massive stress in your body. I had Bell's palsy when I was 19, and they said I could get it again when I was pregnant.
Of course.
Really shocking. Yeah. Debilitating, looked completely different, managed it fine, but it was the first time that it altered my aesthetic. Yeah.
I would say right now, without wanting to get up on my soapbox about NHS dentistry, I would say at this time in the UK, or specifically in England, let's say, it's not fit for purpose. Mm-hmm. And we are seeing time and time again. So I've been working with the WI. The WI have interviewed almost 900 of their members, so all women. And what I'm seeing there is that during pregnancy, people are struggling to get into the dentist. When they have emergencies, struggling to get into the dentist, we should have some emergency provision, but what's happening is that people in reality are even struggling to get emergency dentistry now. And we see reports of women saying, I'm already worried about moving home because I don't want to go to a new area and not have a dentist. And we're seeing reports within this kind of cohort of women saying, I'm traveling 150, nearly 300 miles, some women, to go back to a dentist where I used to live. This is the situation. Or moving to a new area and there's nowhere within area. And maybe some of these people have access to a car. Maybe they don't. Maybe they're in a rural area and they would have to get on a bus to travel a certain amount of time to get to somewhere out of area because the NHS provision is poor. So I would say at the moment we are having, and it's in the headlines, we are having an NHS dentistry crisis. And it's affecting real people, and it's affecting real people every day. You see people posting videos on Facebook and other things, struggling to get themselves, their children, having to travel to different cities. So really it is challenging. If you have something like a frank trauma, so as we're talking about, not maybe a life trauma, but a physical trauma to the face, and your tooth is knocked out, first of all, I will say, pick it, lick it, stick it, which means pick that tooth off the floor, lick it to get any dirt removed off of
Yeah.
it, and stick it back into the hole where it came out of. Okay. If that whole tooth has come out and you're a kid and you've had like a, a hockey accident or something like that. Okay. So I'd say that
Pick
first
it,
of all,
lick it, stick it.
pick it, lick it, stick it.
If you see a tooth hanging out,
Yeah,
move.
the longer a tooth is out of the mouth, when it's been knocked out of your mouth, then the poorer the prognosis of that tooth surviving when you do put it back in. It needs to stay moist. It needs to stay in your mouth. So I'd say that first of all, as your kind of like, sports trauma kind of thing you may see regularly. But what I would also say is that is a good time to be presenting maybe at A&E or call 111 because that might be something that you want to check if you've had trauma that you haven't got like a bigger fracture. So not of the teeth, but of what's called your alveolar bone. So the bone that holds your teeth into your jaw. So you want to be checking there's nothing like that going on. Obviously head traumas, other things. So there's a legitimate kind of reason for that trauma where a maxillofacial team would then need to see you, take x-rays, proceed accordingly, etc. And do what's called splinting your teeth. So looks a bit like having a brace on your teeth, but it just holds them in place. It's just there if they're a bit wobbly or knocked. So that's what I would say about that. But people are turning up to A&E, and not just A&E. Maybe there's things like facial swellings and they turn up and present at the hospital, but some people are also doing DIY dentistry now. Yeah. And this is an issue that we are talking about out of, for some people, desperation. Okay. And this is, we're talking about a developed country with a national health service in place, and people are potentially trying to pull out their own teeth. Many of the women I was speaking to just in the last 2 weeks were telling me they'd shaved down their own teeth, so filed them down with nail files because they were sharp, because they either they couldn't get into a dentist, or it's so known in our public consciousness that there are no dentists available that people are kind of resigned. They're like, I'm not going to find anybody, even without trying, or they've been rejected so many times before. They think, I'm not going to try again. I'm going to do something myself. So I think that people are turning to DIY dentistry in that way when they have some problems.
Good Lord.
Yeah.
I am absolutely gobsmacked. I mean, nothing shocks me in this sort of space, in this industry, in the industry I'm in and the industry you're in. But why I still feel this like irk, this jar of, oh my God, I think it's more because I feel so upset that people feel they have to turn that way. And I see it, in the aesthetics industry as well, with people turning to doing treatments themselves, which is just so shocking to me. Yeah. But it is,
I might just mention, just before we move off that, is one of the things that not a lot of people know and get asked questions about, what kind of products we can see on TikTok, especially things for tooth whitening. So another DIY tooth whitening.
Yes.
Now, in the UK, just to make this clear for the listeners, if you are using hydrogen peroxide, which is our usual whitening product, and it's over 0.1% in strength, that has to be prescribed by a dental professional.
Yeah.
And anything below that is not effective. So my question is then, what is in these products, or are they being sold in a way that's illegal within the kind of rules and regulations of this country? So be judicious about what you're purchasing offline. A £4 whitening kit off of TikTok or Shine. Be very careful what you're ordering, and check that if you want to ask for some advice, obviously speak to a dentist. But I would say the best way to do it is to go through your dentist if you're looking to whiten your teeth.
Okay. Whitening, while we're on the subject of that, then anybody listening, because it is a minefield. It is a minefield. Yeah. Like skincare is. You now go down the aisle for toothpaste.
Yes.
And I'm like, what am I? Where am I? Do I use the one that says sensitive and whitening? Do I use the one that says pro enamel and sensitive?
Yes.
I actually don't know. I just use the one that tastes nice. And it's sensitive because I have sensitive teeth and receding gums. It's all very sexy over here.
Yeah. You're quite right. There's so many things. There's such an industry in it. And the industry knows what we've just been talking about. The norm is changing. Everybody wants super white teeth, as white as possible.
Yes.
And for the most part, with toothpastes, they can help with some surface stain.
Okay.
Sure. To a degree, but some of them might be quite abrasive.
Yes.
So be careful, especially as you're saying, teeth might be feeling a bit weaker or receding gums.
Yeah.
So they can be abrasive, and that's what removes that surface stain. They don't attend to the stains that have been absorbed into your teeth. So
Okay.
long-term stains that have fundamentally kind of pigmented your teeth from things like long-term coffee drinking and long-term tea drinking. I love my coffee. But that really needs a hydrogen peroxide bleaching so that can be actually taking out those staining
Okay.
molecules and addressing the stain that's deeper in your teeth.
Okay.
Sensitive toothpaste, yes, they do work. So
Okay.
I'm not going to say any specific brands here.
No,
I think we'll probably
fine.
have to stay brand clear.
Fine.
But there are products in the toothpaste that specifically address sensitivity. We've kind of got, if I could explain it, so in the middle of each of our teeth, we have a nerve. And we've all heard of like nerve pain. It's
Yes.
what feels sensitive if we bite onto an ice cream, something like that. But there are almost channels coming from the surface of our teeth that feed information to those nerves as well about the temperature and things like that. And what those sensitivity toothpastes do is they kind of make a little cover, they occlude those little channels
Yeah.
so the nerves stop kind of sending down information. Oh, this is sensitive. Oh, this
Got
is
you.
really cold.
Got you.
So they do help, and you can find, even if, you could brush your teeth as you are doing, but even if you've got a particularly sensitive area, a little bit of sensitive toothpaste on your finger, you can just apply that to the area as well.
Nice.
And that might just help like in a topical way throughout the day.
Quick one while we're on
Yeah.
toothpaste. I've heard because people say, as we do, we use the royal people in this term, kids' toothpaste is not necessary. Kids can use adult toothpaste, because I see so many families using, if I just go to my friends and whatever, using children's toothpaste. And I've never subscribed to that, because I think I was told years ago that it's not necessary. They can just get into adult. Is that right? Is there any truth in that?
But for the most part, it's absolutely fine for children to use an adult toothpaste. What I would say is that you want to use the tiniest amount. So if you are using an adult toothpaste, that is a fine concentration to use, but you want to be using like the size of a grain of rice.
Okay.
So not even a pea, especially for younger children. I still only use like a small smear, and my girls are 3 and 5. So, a very small amount, because there's fluoride in there. They're still developing their adult teeth. You don't want them to get too much fluoride exposure. But yeah, it is fine to use an adult toothpaste.
Okay.
So it's more important to have the fluoride in there. The absence of fluoride means that toothpaste is virtually ineffective. But what I will say as a caveat to that is that there has been new research emerging in recent years about a different type of toothpaste that contains hydroxyapatite. And I was first seeing adverts for this on Facebook. I was like, okay, what's this hydroxyapatite toothpaste here?
Yeah.
And I always go to the evidence. I'm straight to the evidence. Well, what does the evidence say? Well, I'm going through my databases. I need to know. And actually, there's a lot of well-conducted trials now saying hydroxyapatite is about as effective as fluoride. There's not much difference between them.
Okay.
And the reason why I mention that, people worry about fluoride. There's a lot of scaremongering around fluoride.
Like
is it an endocrine disruptor? Is it this? It's in the water. Is it some sort of brain control thing? I've heard these sorts of things. But which to my knowledge, there's not a lot of truth in that, especially at the concentrations we use. But hydroxyapatite is like a part of the structure of our enamel anyway.
Right.
Hydroxyapatite is within our enamel. So it's using that to put minerals back into your teeth.
Wow.
So it doesn't affect the bacteria in our mouth as much, doesn't affect the microbiome in the same way that fluoride does.
Yeah.
So we can start to see some good alternatives coming through if you want to use something that's effective, but moving away from fluoride as well.
That's so interesting.
Yeah.
As we get older, then, I'm going off topic a little bit because we'll bring it back, but as we get older then, and as we age, what happens to our teeth's ability to protect itself?
Yeah.
Because I think this receding thing, I've been told to do more flossing. And obviously when you're younger, your teeth are healthier, whatever. Is it because we have more calcium in there and we start to just see the natural aging process? When I talk to aging with my patients, I know we get bone recession. I talk about mid-face slippage and all that sort of stuff. So we do get bone reabsorption. Is that happening around the
Yeah, that is happening around the teeth. So if we start to think, I'll think in specific about women because this has an impact on women. So women's hormones will change throughout our lives. They'll change from our years where we're menstruating to our years where we're peri and postmenopausal. And we see with that osteoporosis.
Yes.
So diminishing bone turnover.
Yep.
Bone is what holds our teeth into our jaw, okay, as well as a periodontal ligament, so a ligament that attaches the teeth into the bone. And what we see is that when we have estrogen withdrawal, such as we see during postmenopause, we get bone loss around the teeth. Okay, so and that might present as more gum recession. That might present as teeth that have more gum disease as well. So we can see that link there, but there's other things that are going on as we age. And I'm going to stick on the thread of our hormones as well at the moment, because the absence of estrogen can also lead to dry mouth.
Yes. Yeah. Yes, you see that a lot.
Saliva is not just a water that is in our mouth. Okay, saliva has loads of protective properties.
Yeah.
It protects our teeth. It buffers away acid. We can then sort of swallow away any acid or sugar and wash it away. When you don't have saliva in your mouth or very poor saliva quality, you start to be more prone to dental decay.
Yeah.
And some people might find then they're starting to sip a sugary drink, a fizzy drink, a tea with a sugar in it to hydrate their mouth. And that sugar is not going to be cleared from your mouth. It's going to sit on your teeth all day. So there's issues that come along with that. So we've talked about the dryness, we've talked about the bone loss around your teeth, but also one of the things that we are finding is around facial pain. And I'll mention this as well, because women might be thinking this is maybe not dentistry related as such, but also women in menopause get more facial pain that affects around their lips, around their tongue. So burning mouth syndrome, trigeminal neuralgia, which is like a nerve type of pain, very shocking electric shock, and temporomandibular joint dysfunction. So dysfunction of our joints, they start to click. It's like a little ball and socket joint with the disc in the middle. That disc starts to degrade a little bit when our estrogen goes down. So you might get more clicking, popping and locking. So these are the sorts of things. I'm making menopause sound really glamorous now, aren't I? But these are the sorts of things that we find that we are affected with as we age, and teeth do naturally become more yellow as we age. And teeth will have naturally been exposed to the bacteria in our mouths for longer. So in our gums, just to explain to listeners, there are two different things that can affect your gum. One is gingivitis, which is a reversible swelling that if you brush really well and you make sure you're cleaning between your teeth, it will go away. When that gum disease becomes more severe, you start to get something called periodontal disease. And that's where it's a combination of the bacteria, so in plaque on your teeth, and your body's response to that leads to that bone and that ligament holding the teeth in kind of getting less and less until your teeth have problems like being wobbly or more bleeding gums. That is a chronic condition. So we're talking about two different things there, but certainly what we can see as we age is that then we'll have been exposed to that plaque bacteria for longer. So there'll be more recession of the gums. We see the teeth becoming more yellow as the nerve in the middle of our teeth, it sort of shrinks away, almost like fills in with lots of dentine, which is the kind of substance, the springy substance in the middle of our tooth underneath the enamel, and it kind of fills in. And then when the light shines on it, how the light bounces off our teeth, like the refractive index, starts to change. It looks different. It looks yellower.
Oh, that's so interesting.
Because the teeth are becoming more dense.
I could listen to you forever. Don't you think?
So much you didn't know.
It's just amazing. I honestly feel like we need to get snuggled in because it's so interesting. And I think there's so much going on that we're not educated on. We're not aware of.
Yeah.
When I go to the dentist now, I'm invariably there with my children. So I don't have the time to talk to my dentist because we all tend to go together and we all do the trip. So I wouldn't do that. But I think now I want to take more of an interest because, I want to make sure that this is a big thing. I want to make sure that I look after my teeth, and it's made me hyper aware now of the need to do that, even though we know about it.
And I think we don't know what we don't know.
We don't know what we don't know. Right. We don't. But but that's, I think more people need to be aware of these things and the changes that happen as we get older.
Absolutely. And the crucial times for women. So, when we're thinking about hormones, pregnancy is a crucial time. We know that not only does pregnancy with the real massive sort of peak of hormones affect our gums, but also having gum disease while you're pregnant can affect gestational diabetes. It can affect preterm birth, so lead to preterm births. It can lead to low birth weight and even preeclampsia are associations. I can't say one absolutely causes the other, but I can say, do you know, there's a really strong link here between oral health and pregnancy. So there's key times in our life, which is why the NHS during and then post-birth provides free access to NHS dentists if you can find one, because they recognise this is such a pivotal time for women in terms of our hormones and what's going on. So certainly throughout our life, we need to be
But we are only just talking about this, Jan. We're only just starting to talk about menopause. GPs don't specifically get trained in menopause. 40% of their GP practice is made up of menopausal women and they have no formal menopause training. No. It's really scary. So you might think that instead of going to the dentist to talk about what's going on with your teeth, if you're in pain or whatever, you might start to talk to your GP about it. But you talk to your GP about your physical or mental symptoms, forgetting that oral health might be part of that. And I think that the conversation has only just begun, and we're lucky it has, but because of the rise of Instagram, and the fact that women are talking more openly and freely, and we're being allowed, and there's more education around this anyway, and more people are prepared. Like Louise Newsom's massive.
Love Louise Newsom.
Lovely, she's great. It's really like taken that on. Davina McCall's done loads of stuff around women's health, and I think that we're now at least getting into this space, talking about what's happening in the oral space as well, is being a bit more acceptable where women are concerned. They're much more vigilant about it, and I think that starts from where they see me as well. And I'm certainly going to ensure and make part of my practice lean it into more oral care and oral health and how they feel about that.
Yeah,
I think
absolutely.
it's fascinating.
I think this is, you've really hit the nail on the head here around education for the public, but also education for healthcare professionals. You sort of tapped into GPs. This week, we've been talking to obstetricians and gynecologists who didn't really know of the links between oral health and pregnancy and hormones and oral health. So, that's kind of missing there. And as dentists, believe it or not, during my training, I did not have a lecture on women's oral health. Like, women turned up in places. All right, we're having a lecture on facial pain. We'll maybe mention women there because facial pain occurs more frequently there. Or maybe we're talking about pregnancy. So we'll maybe mention a little bit about something about women there. But now, coming in the position that I'm a lecturer, I'm engaged in teaching the students. Recently I've sort of said to our colleagues at the University of Liverpool, like, can I introduce this? I want to introduce a lecture on women's oral health. And I want to talk about not just pregnancy, but polycystic ovarian syndrome, contraception, HRT, menopause, all these things that we're talking about, osteoporosis, systemic links with the things like dementia, diabetes, cardiovascular disease, all start to increase in our menopause, and bring in that conversation, bring in that understanding around things that are more difficult for women, whether that's domestic abuse, traveller communities where women have very low literacy, those sorts of things, the burden of booking appointments for children or in-laws and parents and things like that, and that kind of headspace burden, kind of organisational burden that women take on. So there's something there about bringing that to dentists. Even for us, it's very itty bitty and thinking, well, actually, when somebody comes into me, what kind of package of understanding do I have for half of the population here?
But I think what you do, and certainly something that I do, is holistically look at a patient. So I think your spidey sense will instantly be like, okay, you see, you see the age, the stage, the job, they've got children, and you are doing a immediate assessment upon entering your room, which is what I do. So I break down some of the barriers because I instantly get into what's happening, what they're doing. Are they going on holiday? Are they going away? How do they feel? Are they still married? Are they not? How old are their children? You're already doing that assessment, and you've already got that mindset about what stage they're at. So I think that because we take this sort of thing very seriously. There's a new exhibition and movement in aesthetics called the Menopause and Aesthetics Movement, and it's fascinating because we study tons of women, and we want to explain to men as well that are supporting women.
I love the sound of that.
It's so interesting. Yeah, we can definitely go into that. That kind of, it's interesting about the crossover between aesthetics and dentistry, and we're seeing more and more dentists coming into aesthetics land. And I think that some of my patients explain to me that they feel that's a bit shocking. I don't want my dentist to talk to me about Botox and fillers. And I interestingly train cosmetic dentists to do the perfect peel. And they ask me from a marketing perspective, how do I get more patients in? I'm finding it really difficult to talk to them about peels and then do their teeth, which I understand because that doesn't sit well with me at times. However, they I think that they're very, very skilled in understanding, facial bone structures, nerves, max faxy stuff. I get it, and I can see why they'd move into that. It's just from a business perspective, it's not. Because I can, I will. Yeah. And I think that unless your MO is this way, then maybe you'll go that way, but it depends what you do. Do you think that there'll ever be we'll be able to bridge the gap? Because you've talked a bit about aesthetic and teeth and going away. The gap is really narrowed in terms of people's expectation of teeth, the way they look, especially with like people going to Turkey to get teeth done. They would maybe go there before even ever going to a dentist. They would maybe, that might be their first experience after it being a child of going to get straight white teeth, because that's all that's in their mind. It's expensive. Obviously, it's cheaper to go away. I've seen women and men going abroad for years and years and years to get cosmetic surgery done. Do you think that from an ethical point of view, we need to be bringing that back into the UK? Do you think it's okay for them to go over there? And do you think that there are some incredible places? Like, where do you think that this real, I mean, it's the same in aesthetics. I think I know where it comes from, because it's that like instant fast fix.
Quick fix culture. And I think that's where it does come from. And there's this understanding about dentistry being expensive in the UK. So I think, as you say, people don't even turn up to ask for a quote. And it might be so different to what they're being offered elsewhere. And that's not to say, and I want to make this very clear, that I don't want to take away from the skills, the legitimate skills of dentists in any country providing dentistry to UK citizens who've gone abroad for having their crowns or veneers and cosmetic dentistry. But because of the time-limited nature of that visit, you're going out, you're there for 5 days, 7 days, whatever it is that you're having done needs to be done in that period of time.
Yes.
Now, in the UK, we look towards like an align, bleach and bond. So straight align by straightening the teeth, bleach, whiten them, and maybe bonding, which is composite bonding that many will have heard of. So you put a tooth-coloured sort of reshaping of the teeth. So that's quite popular in the UK. That's kind of where we sit. And that's called a minimally invasive approach. But if I want to align your teeth, okay, with myself, my colleagues who do aligners, maybe that's 6 months, maybe that's 12 months, or even 18 months of treatment in order to get your teeth straight and whiten those teeth. Okay. But that might get you to where you want.
Yeah.
You might think, I've had my teeth moved a little bit and they're lighter and now I am happy. And you've done very minimal, if any, damage to those teeth. Okay, they've moved in position, they're lighter, and we've used a safe whitening product. However, if you're going abroad and you need something done in a week, then that might be, right, well, in order to radically change these teeth, because we're not moving them, we have to take away more of your own tooth to put a cap on the top so we can make that tooth look like it's in a different position. Okay, if you've got a bit of a sticky out tooth, you're going to intuitively, you need to cut it back and put a crown on it. And ideally, maybe an ideal treatment plan would be to have Invisalign. But Invisalign's not going to be done tomorrow.
Yeah.
People want things yesterday. And I think that can be where people aren't necessarily understanding that when you have a crown done, okay, 1 in 5 of those of the crowns that are done, you will have a problem with the nerve of that crown. That means you'll need a root canal treatment. All right. The nerve will die at some point. If you have 20 crowns, that's 4 out of those 20 crowns that the teeth at some point in the future, potentially 10 or 15 years from now, are going to need a root canal treatment. They're going to need more treatment. The average kind of longevity of a crown, maybe 10 to 15 years. If you're lucky, veneers shorter than that. If you are 19 and you are going to have 20 crowns put on your teeth, those crowns will need replacing again. So crowns, some people might call them caps. It's easier to understand, but they will need replacing before you're 40. And they'll need replacing again around about before you're 60. Gosh. If you don't have any other problems in the meantime and if they last for a long time. So what we're seeing is if you're starting early with this quite destructive treatment in order to get that cosmetic look, you might be then losing teeth. Nerves might be having problems or they might not be savable. And we talked about health, people sort of potentially confusing what a healthy mouth looks like, straight white teeth, versus what actually a healthy mouth is, which is the absence of plaque, healthy gums that don't bleed, that your teeth are clean. You know, that is health. And we talk about, you know, strong teeth and gums. Yeah. If you have not got your oral health in place, like with your skincare, if you haven't got your skincare in place, if you haven't, or not having maybe your regular facials, so if you're not brushing your teeth, if you're not having your regular hygiene visits, your mouth will have inherently more bacteria and more plaque. And then we're adding in caps on top of the teeth. Sometimes there's a little bit of a ledge between where a cap meets a tooth that can gather plaque. So you might see more gum inflammation. Suddenly your teeth become harder to clean. So really, health, that preventative aspect, your oral health, your hygiene cleans, you need to have that nailed as well before you start adding in things like crowns that make it much more difficult to look after your teeth, make you much more prone to gum disease. So there's a lot to think about here. And sometimes I think about, with skin, I know we've talked about this before, you might start with skincare, then you might progress to something like kind of facial treatments, peels, then you might progress to something like injectables. And then, do you know what? You get to a point where it might be something like a surgery, all right? Plastic surgery or blepharoplasty or something, depending on what's going on for you, and that's kind of a stage. And I know myself, I went through that journey where I thought, right, I want injectables. And then actually I started to have conversations, and that was about 2.5 years ago. And I haven't had them yet because I upregulated my skincare, my facial care, going in for facials. And I felt like, do you know what? That's great. That's great for me. I'm 39, 40 next year. I'm feeling good about myself and I look good. And so it just kind of eked that out and made me feel much better. So that's the kind of thing I'm thinking about oral health. Like, to me, that last step in the line is where you are going for something that's irreversible.
Yeah, you're right.
And you're having that full mouth of crowns, because before that, you need the brushing, you need the hygiene. You could be doing tweaks with moving your teeth, a bit of bleaching. You could be doing these minimal things first before you get to that stage, that end of the road.
Unbelievable. I feel like, listening to you, we need, those embarrassing body buses. I feel like we need to take this on the road. We need to have a bus in the middle of Manchester that we're in, and one end's like aesthetics and facials, and one end's like true, real, honest advice about teeth and dentistry, because that's you've got so much knowledge, and I think it's so interesting for people to understand things from your perspective, because of your history, and you're so what you've been exposed to. I think it's absolutely fascinating. This is one of my favourite episodes.
That's so nice. I'm so enjoying having this chat.
It's just amazing, honestly.
Well, may I add one more bit before we move on?
Yeah,
what I want to say is that people who have made or are in the process of making the choice to go abroad for dentistry, what I would also say is, there's a lot of blame culture from dentists towards patients. Patients feel reluctant to seek care. There's a lot of fear from dentists around litigation. So if I now rectify the problems that are occurring or try and deal with that, I'm potentially at risk of getting sued myself.
This is a thing.
So this is a real thing. But I don't blame people for going abroad, because there is an NHS dentistry crisis. Dentistry can be expensive, and people are looking for maybe something that's recommended by a friend, and if your friends and family have done it. But also, as we were talking about, people might be feeling vulnerable, might be feeling self-conscious. Maybe their main source of income is something like Instagram, where you have to look the part. There's an expectation of looking that way. And that makes people much more susceptible to predatorial marketing.
Of course.
Okay. So I can understand why there are so many drivers, both from a system perspective from the NHS, but also from like people's internal kind of
100%.
experiences of life and stigma, shame, that are driving people to go internationally. I don't think anybody goes there, just on a jolly without consciously thinking about it, because it is such a big decision.
It's huge.
And you can see the turmoil that people have in decision making on the Facebook groups. They're asking for advice. Who's reputable and who's going to do a good job, and that sort of thing. People aren't just looking for the bottom line. They also want quality as well as something that's affordable to them.
Very true.
But the challenge for me as a dentist is, if somebody asked me to come, talk to them and say, where should I go? I don't have a list of reputable providers. No. I don't know who to send you to. That I could give you some different opinions of what we can do in the UK, but I can't advise you. So people are seeking that and getting misinformation, disinformation on the internet.
The problem that we've got is we've got this. I think that the dilution of our qualification and what we and who we represent, who we are, because our speciality in terms of where we work and what we do as individuals is diluted, because many more people can do this than ever was there before. If I'd spoken to my mother at 19 saying I was going to go over to Turkey to get my teeth done, it would have been like shock, horror. What on earth do you think you're doing? Same was as people going to get like breast enlargement or liposuction in Turkey or wherever. still shocking to many. However, it's become so accessible. It almost feels like it's de-skilling, although it's not about going to another country. It's about the lack of accessibility in the UK because of it's cost prohibitive, and less about safety. And I think that we've moved away from a safety aspect. We're not as considered about safety, but that feeds into the same thing that, when like fast fashion with clothes and stuff, we've become a nation of instant fast. I think there's a certain element post COVID that we're a bit more reckless than we ever were, because we're like, all of a sudden we were going to die within a minute of walking outside our house, or we've gone the other way. We've taken things upon ourselves now. I have to rely on myself because I can't rely on the government, or I'm not being told the truth. I think there's so many different ways to look at how the world has changed. And what it's telling us about how we can access these sorts of things. And I think when you've got you and I that aren't diluted, in fact, it's the other way. We're like, desperate, like sponges, and always learning and constantly wanting to make an impact and a difference. We're certainly not diluted, but that's not what the consumer sees, especially with the rise of Instagram and TikTok and this like fast nature. And you should. So I get that completely, and I find it tricky.
And when there's consumer demand, I speak to a lot of young dentists, my role at the university, and there's a lot of push that is quite different to when I graduated 15 years ago, towards wanting to do aesthetic work and the kind of before and after pictures, and there's a big drive towards that, and that changes the bell curve of what normal is, as we've spoken about, but also then who's going to do dentistry that's just necessary.
Yes.
People still need fillings. People still need teeth taking out. People still need, biopsies and other things. So across the workforce, we need to also look at, yes, people are going towards this kind of Instagrammable culture of what dentistry is, but we still need that just general health-related dentistry there.
Absolutely.
Perhaps more than ever now, because of issues of access. So there's a lot going on both in the professional market as well as like the kind of patient market of what people are pushing for. So, and sometimes quite difficult to have those conversations where people come in, you see a lot of disease, you think there's a lot we need to do to stabilize you in terms of, you've got lots of holes here, or there's gum disease. Before we can do the aesthetic stuff, we can't put cosmetic into your mouth as it stands. We need to get you free from pain, free from disease. And that can sometimes be a really hard conversation to have, because it might take 6 months to get somebody into a space where their gums are healthy again and all their dental decay has been filled and they're free from pain and they've had any root canal treatments done. And then we can have a cosmetic conversation once we've restored health.
Yeah, well,
so it's going to be really challenging to have that.
And that's kind of I have the same challenges. My first, like you've said, my first thought is, let's get your skin in good condition before we do anything else. We're not going to fill first. Let's get your skin back up to health. Let's get you looking at yourself and feeling like you feel great. Start the day off that way.
Yeah.
I think I was talking to you about, I can't remember if I mentioned it to you or not, but when we went out for dinner, Vanessa Van Edwards she studies bodily cues, and she was talking about catching the fear, right? And there's been a recent study with toxin that's just been licensed for the treatment of psychological impact, which I think is insane. What a movement! And there's this link between looking good, feeling great, and how that changes your mental. It's unbelievable. And I think your teeth do that as well.
Yes.
For sure.
Yes. I know from myself personally, just about a year ago, I had my veneers redone. I had veneers put on when I was 15. We won't even go into that, but, it was far too young to be having veneers done. But I had my veneers done at a young age, and it came on that kind of 20-year mark since I'd had them done.
Wow.
They needed redoing. Surprised they lasted that long, but it was time. And they had changed, you could see the edges of the veneers. They'd become slightly stained. My daughter had bumped my tooth with her head. It had a little crack down the middle. It started to pick up some stain on the front of the veneer. And I was hiding my smile. I was guarding. I hadn't really understood what a toll it was taking on me. And I was really psyching myself up, because it's a big thing to have these veneers drilled off and re-put back on. It's no small thing.
No.
So as soon as it was done, I could I could feel myself being able to smile widely again
Wow.
and not feel conscious and just not be aware of myself.
That's huge.
Because we're always thinking, we are social creatures. We're thinking about what people are thinking about us, right? We're making, they see this on me, they're assuming I'm like this. So, and we live this narrative like through our assumptions about what they're thinking. And I can definitely say I understand that now more deeply. I've lived it personally, and I can see as slowly, insidiously, like erodes your self-confidence and your relational competence, I think, in terms of like smiling and talking to people and engaging.
Have you got amazing dental like rules at home? Are you amazing at it? Because you know how when people that are hairdressers always say I'm the last person to do my hair.
Yeah, I think
do you go through
that's
ebb and
fair.
flows of it?
Yeah, do you know what? I would say that very much applies to a dentist as much as it does to anybody in any profession that they're in. I think we are so busy. We're so busy with work. We're so busy with families that, I'll brush and I might think, I could have brushed better, or I haven't used my TP brushes between my teeth this evening. I just, I'm human. I'm absolutely human. And some days my oral hygiene will be immaculate. And other days, like anyone else, I get tired or, always a brush will happen. But can I say that, 99, 100% of the time I'm using my TP brushes meticulously? No, okay. But what I do know is that I try my best.
Yeah.
I try my best on any given day.
Yeah.
And sometimes if you're having a 2 out of 10 day, can you expect to be 10 out of 10 on everything?
Yeah.
Sometimes I have to accept I'm having a 2 out of 10 day, and the best thing I can do today after everything that's happened, or, kids' difficulty going to bed, whatever it might look like, the best thing I can do is do a good brush with my electric toothbrush. And that's all the energy I've got left for. So there's a bit of kindness here. There's a bit of compassion. There's this idea of we have to be perfect, but you know what? Like there's good enough as well. And you try your best, but also don't give yourself a guilt trip if there's a night where you're maybe not doing your flossing or you've not done your full 2 minutes. Pick it up the next day, do your 80-20 rule most of the time, do it well. And then there's days where you just think, today's not the day for perfection.
Thank goodness.
Yeah.
We can breathe. We're allowed. You heard it here first. We've pretty much talked a lot about what I believe that people listening would want to know about, and even some of the stigmas around the industry and all that sort of thing. So I don't think we need to kind of labour the point about what it's like to be a woman in dentistry, what it's like. I think that we can come back and we can revisit these things. What I do want to talk about though is some of the things that people might talk to you about or say. We've mentioned this, but we've talked about being scared, feeling judged. Does it start from a child, that first initial connection with a dentist? Or do you think it happens when you start to be more aware of what can go on? If you've got a great experience as a child, then should that follow all the way through? Or can just certain things like...
I can only go off of what people tell me about. So what patients say about their experiences, and it can be generational. So I talked to an older generation who might have had gas and air. So they might have been put to sleep in a dental surgery, which is not something that we do anymore because there are a number of fatalities off the back of that. So we don't put people to sleep, but they remember that mask. They remember that sleeping and waking up feeling so groggy and awful, maybe blood around the mouth. They don't know what's gone on. And so people I talk to generationally who may be in their 60s and 70s, older people with dental fear, remember that time as a child. I think, yes, if you have a really positive experience with a dentist that puts you in control, I do take out teeth on children, young children. I take out adult teeth when they need taking out, not just, for fun, but when they need taking out, I take out teeth and we still have a good relationship after that.
Amazing.
Okay. So there's something there about you build that relationship, you build that trust and understanding that things might be uncomfortable and being transparent about that. I don't hide things, don't tell porcupines, try and say the truth and speak in children's language. I think you can build up great relationships with kids that then last for life. There might be times where unavoidable things happen, where something is distressing and children or adolescents might feel really distressed during doing something. Things feel uncomfortable. We hear sounds, it's unfamiliar, and that can stick. It can stick like that kind of, light bulb memory. whatever, like a snapshot memory.
Yes, yeah.
Where it just comes back to you. And every time you go in that situation, you feel that way. You feel out of control. So there's a lot going on there. And especially if parents are also conveying those messages of nervousness. So sometimes parents come in with a pre-existing anxiety or dental phobia, and that can sort of rub off onto the kids.
Yeah.
So there's lots of stuff going on there. It depends. I didn't feel like I was nervous about going to the dentist until I was 15 when I had those veneers placed. And after that, I was very nervous. I had the molds. They made me retch and gag. There was lots of treatment going on, lots of injections. And after that, I became really phobic of the dentist, even though I had a great relationship with my dentist. I did my work experience with her, etc. So at any point, really, things could change. And you try as a dentist to be as supportive as possible and to have to manage those situations in a way that doesn't trigger a phobia for somebody.
Yeah.
But sometimes it might be inevitable.
Okay. That's so interesting. I swear to you, I could talk to you all day. Last question then. And if there's anything you want to talk to me about, you tell me. Electric toothbrush or manual toothbrush?
Okay. Yeah. Interesting one. Okay. So if you have a great technique with a manual toothbrush, there's no reason why you shouldn't use a manual toothbrush.
I get a bit shocked if I see somebody with a manual. I'm like, oh,
I
know,
know,
in the 21st century.
Sometimes I don't mind the odd bit, when I go away on holiday, I take my manual toothbrush with me. I think, oh, this is so refreshing. I feel so like, it's like you're working hard for it.
Yeah. You're working for your
practice my skills here.
Yeah.
So if you've got a good technique, if you've always been using a manual toothbrush and your dentist's going great, you've got no gum disease, everything looks really healthy, you know what you're doing, carry on with that. Some people have sensory issues. They cannot stand the sensory issues, like the sensation of an electric toothbrush. For people with ADHD, for example, sensory is a big thing. So spicy toothpaste, buzzy toothbrushes. What I would say for electric toothbrush, it makes things easier.
Yes.
Most of the research has been looking at the oscillating heads. So that's the round heads that kind of sweep back and forward, and they just sweep away the plaque in a really lovely way. And they have been found to be more effective than a manual toothbrush if you use them. It's less technique sensitive. You literally hold them on the tooth, so you're not doing a scrubbing motion. If there's anyone out there who's doing a scrubbing motion with an electric brush, stop today. So what you want to do is you want to just hold that brush. So each tooth has three surfaces, right? If we think about our molars, you've got that surface that's against your teeth. Well, it's actually got 5 between the teeth, but in terms of brushing, we've got the surface against your cheek, we've got the surface you bite on, and we've got the surface, for example, on your palate side or tongue side. And we do have the other 2 surfaces at the back and front of the teeth where we floss to clean. But with your brush, you're mostly worried about those 3 sort of main surfaces: cheek, biting, and next to your palate. And you just want to hold the toothbrush on there. That oscillating movement, so the head is moving itself, sweeping back and forth, and for 3 seconds on each surface. And it is going to do the job of cleaning that tooth. All right. So you move it gently, but you don't do a scrubbing motion. It's not necessary. So you can just move from tooth to tooth. And I always say do it systematically. So I'd say if you're right-handed people tend to be a little bit terrible. It's sort of bending your wrist backwards and getting that right-hand side. It's a little bit of a tricky place to start. So start there. So you say top right, and then move yourself all the way around to the top left. And then you start on the bottom left and you come all the way around to the bottom right. So you know that you're not missing any places, because people will commonly miss the canines, which is your pointy teeth, your third tooth back, because they kind of focus on a straight line across those back molars, a straight line across their front teeth, and the little cornerstones of the arch, your canines, sometimes get missed and they get a lot of plaque gathering. So I'd say you want to be using manual. If you've got excellent technique, fine. Make life easier on yourself by using an oscillating electric toothbrush, and then use TP brushes between your teeth. So I think to make this point clear, if you use a tape floss, the whole idea of going between your teeth is to break up this film, this plaque, to get rid of it so that your toothpaste can get onto that surface and it can sort of protect your teeth. If you're using a tape floss, it doesn't really move much.
No.
It doesn't really remove that plaque.
Yeah.
Whereas if you use what's called a TP brush or an interdental brush, it looks a little bit like a bottle brush. It's got bristles on it and it cleans in 3 dimensions. And so when you put that through your teeth, you are cleaning both the back and front of the teeth that are next to one another, and you're cleaning up and down, and it is much more effective than a tape floss. So if you are using tape floss, I would say switch over to an interdental brush, get the right size for you, because there's lots of different sizes.
Yeah, that's right.
And then combine that with your brushing.
Can we just like mic drop, please? 'Cause you are phenomenal And I absolutely love you more today than I did yesterday. So thank you so much. I don't know why you make me feel emotional. We're looking into your eyes.
It's been wonderful. Really nice to chat.
Have you enjoyed it?
Yeah, I don't know how much time has passed, but I've been talking about, a great subject with a great person, and it's really interesting to bring something new to your listeners. And maybe just, in this last week even, I've realized that I personally have something of value to share with others, which sounds strange, right? Outside of the patients I see one-to-one.
Yeah.
That other people might find useful or want to listen to. So thank you for allowing me to have a platform to hopefully share things that are useful, some tips, and even just some compassion and empathy, and say, whatever way you're feeling about your teeth, you're normal.
Yeah.
And, it's a normal thing to feel self-conscious or worried about how you look. So thank you very much for inviting me in.
Thank you. I need to say no more. You are gorgeous, inside and out. Thank you so much. And we will forever salute you for the work we're doing. And I've learned loads. I am now going home to cry about what I don't do with my teeth.
80-20.
80-20. But thank you so much.
Yeah.
Please come back.
Thank you. Thanks, Kelly.
That's it for today's Barefaced Chat. Thank you so much for listening. If you've loved this conversation, make sure you follow, rate, and share. It really helps more people find us and join the conversation. I'll be back next week with another honest, unfiltered chat. Because skin isn't just skin. It's your story, and I'm here for it.